I'm sure you've heard of Botox, but today I want to tell you a little bit more about how Botox can affect your brain. What do you really know about it? Well, what I know about it, what I can tell you about it, is that Botox is derived from a deadly bacteria. It's a Clostridium that kills its victims by emitting botulinum toxin. Botulinum toxin paralyzes your muscles, and if you get infected by a certain type of Clostridia, it can stop your muscles from moving. It can stop you from breathing. Can you imagine how horrible it would be if you were awake and alert and trying as hard as you could to take a breath but not being able to? But I don't want to give Botox too bad of a rap. After all, a lot of the medicines we use are also derived from poisons, and if used properly, Botox, like many other medications, can have very beneficial effects. The FDA, for instance, approved Botox to treat a bunch of ailments, one of which is a severe muscle spasm, a muscle spasm that can be awfully painful or even deforming. It can also treat migraine headaches. But its popularity really took off once the plastic surgeons and dermatologists got hold of it. And at some point, the FDA approved it for cosmetic medicine, for the use of severe lines in the forehead that might be unsightly, or crow's feet around the mouth and around the eyes. But what I wanted to talk to you most about is the evidence that's accumulating that Botox might have some effects on your brain. And although many people have said beauty is pain, it's not worth Botox in your brain. Wait a minute, you might be saying, if Botox was injected by my doctor into my face, how could it even get into the brain? There has been interesting new research that's out by some Italian scientists, and they've shown that when Botox is injected into rats' whiskers, it could find its way into the brain. When I posted that information on Facebook and Twitter, someone commented, "Kudos to the Italian scientist who can inject into rats' whiskers." And I really enjoyed that, as I enjoy all your comments. If you be kind enough to leave them, I appreciate it. And it's not just in laboratory animals. Australian researchers reported that when Botox is injected somewhere in your body, it might not stay put. These scientists discovered that the toxin may be transported from the injection site along the length of local nerves and all the way up into your brain. Other researchers have suggested that even though Botox may smooth out your forehead, it can also find its way to dull your brain. Some Swiss scientists measured the electrical impulses emanating from volunteers' brains before and after they had Botox injected in their faces. They reported that after the Botox injections, the EEG, electroencephalogram, which measures the electrical activity, the amplitude from that test was significantly diminished after they had the Botox injected into their foreheads. Also, and even more worrisome in some ways, is that the Botox may not even need to get into your central nervous system to cause trouble. In other words, Botox can affect your mind without even getting into your brain. What do I mean by that? Well, it's long been known that you can become more happy just by smiling. Psychological researchers have reported that when you move your facial muscles even to imitate a smile, for example, by putting a pencil between your teeth, if you do that, it actually makes you significantly more happy. Similarly, if you're speaking to a friend whose forehead is furrowed by worry or concern, your facial muscles automatically and unconsciously mimic hers. And your brain empathizes with her while your face mirrors hers. So what I'm suggesting, and what other people have suggested, is that if your facial muscles are paralyzed by Botox, and that is how Botox works, by temporarily paralyzing the targeted muscles, it limits your ability to tune into the emotions of others. And it also may make it more difficult for you yourself to feel the full range of emotions. This can cause psychological effects, either short-term or long-term, and that's something to be concerned about, or something I'm concerned about in any case. On the other hand, to take the other side of the matter, I've spoken with highly qualified and respected physicians who've administered Botox both for cosmetic and non-cosmetic reasons for many years of experience. For example, these doctors have used Botox to alleviate these kind of muscle spasms that could be caused by multiple sclerosis or stroke. And the spasms, as I said earlier, can be extremely painful, and they can even cause deformity. And Botox is very helpful for that. The doctors point out that the Botox used in cosmetic treatment is in much smaller doses, which should limit any potential side effects. The doctors have also told me that, in their view, it doesn't seem like Botox would interact negatively in the brain based on its mechanism of action. It works at the junction between a nerve and a muscle. And what's more, they say that the effects of Botox are temporary, and they wear off after a few weeks or at most a few months. In my view, the bottom line is there's no such thing as a free lunch. If a drug delivers a positive effect, which there's no doubt that Botox does, it also may have a potential downside, potential side effects, or potential complications. Botox is no exception. My own feeling is that I've earned all of my wrinkles, along with each one of my gray hairs. So you can keep Botox, you can keep that poison away from my face. But I'd like to hear what you think. I'd love it if you leave comments. I would appreciate it if you enjoyed the video to like it, to share it, perhaps to follow me on Twitter, Facebook, or my YouTube channel, to subscribe to the YouTube channel. I'm Mark Argentiano, and I'm a neurosurgeon. And until next time.